Hi, I'm Sarah Sally, data analyst on the telehealth study. Thank you for joining this presentation on the effect of COVID-19 on cancer patients and survivors, a Canadian partnership for Towards Health study. So through the study, we set out to understand the behavioral differences relating to COVID-19 public health measures, disruption of care, and the risk of testing positive between those with and without cancer history. CanPath, a consortium of 6 population-based cohort studies, invited participants to complete a questionnaire between May of 2020 and December of 2020 on the impact of COVID-19. And we conducted descriptive and inferential analysis on over 73,000 participants, 13,435 of whom have a history of cancer, with 1,517 currently undergoing treatment for it. Through our analysis, we found that participants with history of cancer were more likely than those without to perceive themselves of higher risk if they were to contract COVID-19. 68% of those with cancer history believed that their symptoms would be serious versus 45% of those without cancer history. And 44% believed that they would need hospitalization versus 26% of those without cancer history. Disruption of healthcare was more common among cancer patients undergoing treatment, with 10.7% reporting canceled or deferred surgeries. 18.7% had their medical procedures canceled or deferred as well, and almost 15% reported that their treatments were canceled or deferred. Additionally, approximately 60% reported turning to telehealth. Those with history of cancer reported high adherence rates to public health measures and continue to strongly adhere to these measures over time. We see some deaths of measures like limiting visits and working from home that are consistent with the public health precautions and advice over the summer and into the fall, where many sectors required employees to return to work. And overall, those with history of cancer were less likely to test positive for COVID-19 with an odds ratio of 0.44 compared to those without cancer history. And so our takeaway is that cancer patients and survivors perceive themselves to be of higher risk of being harmed by COVID-19 and were more likely to adopt and adhere to preventive measures. They were also less likely to contract the virus, perhaps as a result of these measures. I'd like to acknowledge the Ontario Health Study team for their effort getting this question off the ground, all of the funders, and last but not least, our participants. And I look forward to your questions at the live session.